Welcome to another episode of the Eating Podcast. This is Alicia, and I'm so excited to have with us today Julie Cunningham. And it's so funny, when we first connected, it was just like me, I was having trouble connecting with her. And it was just like, oh my gosh, Julie's not going to want to be bothered with me after all this. But she has been so gracious and awesome to, come on and share some information about diabetes health and just, talk about all the amazing things that she's doing in her life. So for those who don't know, Julie Cunningham, she is a registered dietitian, a certified diabetes care and education specialist, and an international board certified lactation consultant. She's the owner of Julie Cunningham Nutrition and the author of 30 Days to Tame Type 2 Diabetes. Julie lives in North Carolina with her family and several four-legged friends. Y'all, I am so excited and so happy to actually have Julie here with us, because I know, like myself, many of you all probably have family and friends, or you are dealing with diabetes. And so this conversation is so important to me. As soon as Julie connected with me, I was like, oh my gosh, we have to talk about this, because as it relates to eating, a lot of us are kind of like in like stuck. Like, how do we even approach this? So without further ado, please, please, please welcome Julie Cunningham. Julie, thank you so much for being here.
Thank you for having me. What a great introduction.
Listen, the things that you're doing are amazing. So it's all you, seriously. So Julie, I guess for our listeners, just let them know, like, how did you get it started in this whole world of diabetes, care and management as a consultant and as a nutritionist?
Well, the truth about how I got started was that I moved to a different town, and the only job that was open for a dietitian was as a diabetes educator. Yeah, I live in a small town now, Hendersonville, North Carolina. It's a small town outside of Asheville, and I moved here almost 20 years ago now. And the job that was open, you had to be a certified diabetes educator. And I said, well, let me apply for that job. And I said, I'm not, but I will be. I'll become one, And prior to that, I had worked in maternal and child health, and I really didn't know if I liked diabetes or not. But I said, I need a job. And so they hired me. And little did I know that they had several people try to run their diabetes program before, and it had flopped. And if I didn't make a go of it, they were just going to, cancel the program. But it turned out that I really did like it. And 3 out of my 4 grandparents had type 2 diabetes. So certainly, it interested me for that reason. But I like diabetes because I'm not very patient. And if I have a patient who comes in and their sugars are 300 today, but they're drinking regular soft drinks, or they're eating candy bars or whatever they're doing, or maybe they're not taking their insulin like they're supposed to, and we can fix that, I can get an immediate change in those blood sugars, and they could potentially be in the normal range tomorrow. So that aspect of diabetes is different from maybe some other aspects of nutrition here. And I like it for that reason.
I love that you brought that up about how quickly the turnaround can be if people make those, adjustments in just their everyday consumption. I think some people don't realize that it's the little things that can make the difference. Because I think people are looking at, especially things like diabetes or maybe like heart conditions, and they see this huge like elephant that they're trying to like chew away at. And it's like, there's no way I'm gonna be able to tackle this. When you have, I guess I'm segueing into this, because I'm like, wow, I'm great that we're on this path. When you have patients or clients that come to you that are in that feeling of overwhelm, like, how do you allow them to, like, 1, process that, and then 2, see that it is possible for them to make those changes and be successful at it?
Yeah. Well, if it's a person with prediabetes, I'll say, listen, we only have to do 2 things here, right? We only have to do 2 things. We have to get you to lose 5 to 7% of your body weight. And if you weigh 200 pounds right now, that's 10 to 14 pounds. That's not a ton of weight, right? And we need to get you to move 150 minutes a week. That's it. That's our only 2 goals right this minute. And so we're going to make 3 goals for you before you leave here today. We're going to make 1 goal around your food. We're going to make 1 goal around how much exercise you're doing. And if you're not doing any, then it might be you're going to start moving for 5 minutes a day. And that's all, right? I'm not trying to get you to go from 0 to the person who spends the most time at the gym ever, right?
Right.
And then we're going to talk about whether or not you have any emotional component to your eating. And if you do, we're going to start working on that. So really, those are the three main places where I focus. We make one little goal around each of those. And I always want the goal to be something that I am 99% sure my client can have success with. You know, what is a goal that's a tiny bit of a stretch, but you're 99% sure when you come back in here next week or 2 weeks from now, you're going to be able to say, yes, yes, I met that goal. Because when they have success, they feel good and they know that they did something, and then we can build on that success the next week. We
I
just keep moving forward.
That is awesome, Julie. I'm sorry to cut you off, but I love that idea of like putting the ownership on the client or patient, because I think in some ways, and I mean, I'm in healthcare as well, so I get that sometimes we get into a mode of like, okay, I know how to fix this, this, and this. This is what you need to do. Go off, try it, and then I'll see you in a few months. And I love your approach to what works for you, right? Like I have knowledge around how this can go, but tell me what's working for you. And I think that's where sometimes in healthcare it can be missed and people aren't getting the care they need. How do you feel about that?
Yeah, I would definitely agree with that. You know, people tell me a lot that they'll say, well, my doctor said I have to lose 50 pounds. I'm like, okay, well, okay. And they're like, and they're overwhelmed and I can't lose 50 pounds and I don't know how to lose 50 pounds. And I'll say, okay, I hear you. But do you know how to, and they'll say, and they want me to stop drinking Coke and they want me to stop smoking and they want me to blah, 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 blah. And I can't give up my Coke. I love my Coke. I've been drinking Coke since I was 5 years old. And I'll say, okay, can you mix your Coke, half Coke and half Coke Zero? You know, can we make a tiny, it's not perfect. It's not really where I want you to be. But if that's what you can do right now, then we're halfway to where we need to go. You know, I'm not here to tell you you need to be a vegan. Sometimes I bring that up to people that that's a great way to reverse type 2 diabetes, but no one ever takes me up on that, ever. Right? I'm waiting for the person who says, yes, make me a vegan. But until then, we just have to take baby steps, right? And if the person doesn't own the process, I can talk till I'm blue in the face and they're going to go home and they say, that crazy lady said, blah, blah, blah.
No, I love that because, because I'm plant-based vegan. I kind of like, I'm a little leery sometimes when I say that because I do consume honey and people that are like hardcore vegan they're like, you're not vegan. I'm like, okay, that's a whole other story. But I do like that idea of like, sharing with them. It's not something extreme you have to do, right? This is not this big extreme change that has to happen. I can meet you, where you are, and then we can, expound on that. I love that idea.
Yeah. There are people all over the world who eat all different kinds of diets and all different kinds of cultures. And so there's nothing that you absolutely have to avoid and still maintain your health, right? We can have almost anything we want. It's how much of that thing can we have?
Right. And it's so funny too that, we were, talking about that. Is this like a conversation around like moderation? Or is it just like, because I've been talking to a few people about what, what some people are considering what's food freedom, where you have this idea of being free around what you're eating. But would that be something that a diabetic should take on? Like, is that kind of dangerous territory when you're talking to a diabetic, like, oh, food freedom, have the ability and not feel shame around it, but still, be within moderation. You know what I'm saying? Does that make sense?
Yeah, I don't want you to feel shame around what you're eating, right?
Yeah.
I never want you to feel shame around it. But to be totally free when you have diabetes is probably not going to work out that well, right?
Right.
So there's a few ways we could go with diabetes. We can go to veganism, which most people are not going to take me up on, right?
Right.
We can go to a keto diet, which will lower your blood sugar and you will lose weight. But the question is that sustainable in the long term?
Right.
Are you going to be able to stay on that for a long time? And you're missing out on a lot of fruits and vegetables that provide fiber and that provide different vitamins and minerals. So I'm not a huge fan there.
Right.
And then the other method that we can go is basically carbohydrate counting. So usually I land at carbohydrate counting with the vast majority of people. And then I say, okay, this is how many grams of carbs I think you need at every meal, at every snack, right? This is what's reasonable, my best guesstimate for your body. So we're going to start there and we're going to see how your blood sugar responds. And some people are going to have, obviously, they're going to need oral meds, they're going to need insulin, they're going to need whatever else they're going to need. So I'm going to have to work with their provider around that too. But here's what I think you need. And then the proof is going to be in the pudding, right?
Yeah.
You're going to have to check your blood sugar. After you eat how much we think you need, where's your blood sugar landing? If it's where we want it to be, awesome. If you can get away with 45 grams of carbohydrate in the form of a Hershey bar, and you love a Hershey bar, and your blood sugar is still under target, well, then that's something you can get away with.
Right.
And you're free to do that. It's not smart for you to do that every meal. No. You're okay.
Right.
And you get to have that treat, right? If you don't, we got to make some adjustments.
And you mentioned something and I was like, yes, I'm glad she brought this up. The checking of blood sugar.
Yeah.
I've noticed with some type 2 diabetics that they just don't even do it.
Right.
They'll sit down ready to eat and just give themselves insulin and then go to count eating God knows what.
Mm-hmm.
Have you, like, with, patients that you do you see that? Is that a common thread with people that you work with?
Oh, that's very common. Yeah. They'll come in usually for the first visit and I'll say, tell me about how your blood sugars are running if you're checking them. Well, I haven't been checking them. Why aren't you checking them? Because I don't want to know. I don't want to know how high they are because I know they're not good and I just don't want to know.
Wow.
Okay. And I'll say, okay, let's reframe that. I want you to think about that number without any judgment because it is just a number. Okay. And I want you to think about like you're doing a science experiment on your own self. Okay. You are in a lab. You're an observer. The numbers are not bad and they are not good. You are simply observing them and writing them down. And you are noticing a pattern. When I eat this food or when I eat this many grams of carbohydrate, I get blood sugars in this range. And when I eat in this other range of carbohydrate, I get blood sugars in this range. So where's the pattern? And where is the cutoff for me? What's my personal level of carbohydrate that I can tolerate or food that I can and cannot tolerate? That is all that we are looking for, right? Because there's no shame. And I personally might have had a Hershey bar the day before. And if I have, I'll tell them that, right?
Right.
Because I want them to know that I'm not a perfect eater.
Right.
And so I'm not expecting them to be a perfect eater. I just want them to learn from their numbers and know if I eat this, am I going to be off the rails or not?
Right. And I love that you brought it or actually like painted the picture of it being something that you just doing an experiment as opposed to bringing in all the emotions. Because I think that's where a lot of people kind of like shut down, right? It's like, I don't want this shame. I don't want to know how bad, quote unquote, I'm doing with my diabetes management. And so, I'm not going to check these blood sugars. If I have, an issue with a low blood sugar level, so be it. I got my candy in my bag and, hope for the best, and then that's something that's so common that I've seen not only within my family, but just people in general. So that's a great way of approaching it. But I also wanted to I'm thinking about the emotional side of that. And you say that's the third component of what you provide for your clients. Is there a lot of like mourning in regards to like, okay, now I have to really address this issue, and then I might have to let go of some of the things that I do currently eat. Is that common where people are and they might not know that it's like a mourning process, but do you see that like presenting in people when you are coaching them?
Yeah. Well, they kind of go through the stages of, the stages of grief. Yeah. When they get diagnosed with diabetes, right? They're shocked. They're in disbelief. I can't believe this is happening to me. Then they're mad. I'm thinking of one lady in particular, and she says, I've been a runner. I've been a runner all my life. And I really don't eat junk food. And I'm still running 5 miles a day. And I can't believe this is happening to me. This is wrong. Why did I spend all this time doing all this exercise? If I was going to get diabetes anyway, I might as well have sat on the couch. And she has a point, right? She's not wrong. And I don't blame her. I would be mad too because she's working hard. And it's not fair. And we don't, We do know that the less exercise you get and the heavier you are, the more likely you are to have type 2. But rates of diabetes are on the rise in both
Mm.
type 1 and type 2, not necessarily tied to your weight. And what's that about? I don't
Right,
know, right? But yes, there's definitely a period of mourning. And there's people eat for comfort. People eat for reasons outside of hunger. So when you take away that coping mechanism, well, how am I going to get through a hard day?
right,
What am I going to do? If I'm mad or sad, or if I have this other feeling, I don't know how to get through that feeling if I don't have food.
right. And it's funny, I've talked to 2 different coaches that deal with just with emotional eating, and I was thinking about that when we were just talking, and you were saying that when clients do come into you to, like, talk about their everyday, eating habits, that was in the back of my mind, and I was wondering how much of the eating that has been taking place with these people, has it been a lot of emotional eating or, like, eating disorders that you're seeing with some of these people? Or is it just old age? Like, what does that look like in terms of when you break down what's going on with this person? Is it something that's with an eating issue or is it just genetic?
Many times it's not a full-blown eating disorder, but it typically, for my patient, it typically borders on a binge eating disorder,
Mm,
but not full-blown. You know,
right,
there's usually a big emotional eating component that borders on binge eating, but not full-blown eating disorder. And in fact, if I have someone who does have a full-blown eating disorder, I will usually refer them out because I'm not an eating disorder specialist.
right. Yeah, I
Yeah.
was just curious about that because I was thinking, some people that do binge eat or are emotional eaters, their go-tos are things that can be high risk factors that could
Mhm.
involve diabetes. So I was just curious about that. That's
Yeah.
interesting.
Well, if you have a binger who doesn't purge, then they're
Mhm.
going to gain weight, and then their risk of type 2 is gonna go up.
Right. That's
Yeah.
that's so fascinating to me. Wow, that's interesting. It's funny because I was sharing with you before, my one of my major interests in me talking with you on being selfish is because so many people in my family deal with diabetes, and everyone varies, right, with their management, and how they're just on different spectrums with their
Mhm,
diabetes management. But what I've found, at least in my family, is that the majority of people that have had diabetes, I mean, it's been for years, and then they eventually go into kidney failure.
mhm.
How can those that are dealing with diabetes now kind of prevent going into a kidney issue later on in their life? Or
Mhm.
is it inevitable, you know?
No, no, it's not inevitable. The kidney failure is a result of damage to the tiny, tiny little blood vessels that are in
Right,
the kidneys from the blood sugar being too high all the time.
right,
And it's the same kind of damage that people with diabetes get to their vision, which is also from damage to the very tiny blood vessels in our eyeballs. And the same thing as what we call peripheral neuropathy, damage to the very tiny nerves that in our fingertips and in our toes. And all of that is a result of long-term blood sugars running too high.
mm,
So that can be avoided just from day-to-day management of blood sugars. Okay. So if your A1C, hemoglobin A1C is a test that your physician can do. They do it every 3, 6 months, maybe every year if you're in good control. And if you keep your A1C under 7, you're very unlikely to ever have any of those complications.
wow.
Not the loss of vision, not the kidney disease, not the neuropathy in your fingers and your toes. You can avoid all of that. So diabetes is not a death sentence, and none of that is inevitable.
Thank you so much for sharing that, because a lot of people, especially because I grew up in Evansville, Indiana. So it's like Southern Indiana. I call myself a
Mhm.
Southern girl because we're literally on the border of Kentucky. So a lot of people that I know back home that have diabetes, it's almost like they're in the mindset of, yeah, eventually I'll probably have
Mhm.
to go on dialysis. And I'm just like that's where you're going with this? Like, you don't want to figure out how to have some type of preventative measures to change or reverse this whole situation.
Right.
And so I guess for me too, it's like, the mindset of people, how important is that in their care as well?
It's huge. It's huge. You know, if I have someone who comes in and they say, I don't want to be on medicine at all, I want
Mm,
to reverse this, right?
right,
It's not always possible, but it is possible. So let's try, right?
right.
And the earlier we catch that, the earlier we catch prediabetes, or if we're in the very early stages of type 2 diabetes, then yeah, it's possible that we might be able to reverse it. We might be able to just stay diet controlled and not even need medicine for a really long time.
Mm,
So if you're for that and that's the path you want to go down, then absolutely we can try that, and it's very doable for people.
okay. No, that's, gosh, I mean, I'm just thinking about just family members of mine and just, I mean, and some of them have passed on,
Yep.
but, you know, them thinking, because I wanted to kind of segue into this, them thinking, oh, I've taken my insulin, I'm
Mhm.
good.
I'm good.
I can eat whatever I want. As long as I'm taking this insulin, I'm fine. And it's like,
Right.
what do you say to, people like that? I mean, and it's not
Mhm.
like a accusatory or making them feel bad, but it's like
Right.
to educate them on the actual purpose of insulin, and then also making sure they're eating as well as they can in the use of insulin. You know what I'm
Yeah.
saying?
Mhm. Well, we talk about, metabolically, what is insulin's role? Its job is to kind of hold hands with the sugar in your bloodstream, and it acts as a key that opens the lock on the outside of your cells and then lets that sugar get through the door. Okay.
Right.
So that's generally the easiest way for me to explain it. And then they're like, okay. And we talk about what's the difference between type 1 and type 2, that in type 1, you're always going to have insulin. You
Yeah.
just plain stopped making it. But in type 2, your body is working like three shifts. It's
Mhm.
like working a triple. It's over producing insulin. It's just that something's up with your cells and they're resistant. It's like the locks are rusty and you need some
Mm.
WD-40, right? So always say exercise is like natural WD-40 for the locks on your cells to let that insulin get in the door. And then they go, oh, and then they see that exercise is going to be super helpful to them, right? And
Right.
then I say, okay, let's just do an experiment. If you're not gung ho about this, just bear with me for 1 week. Okay?
Mm.
Just for 1 week, test your blood sugar before and after you exercise. And let's see what kind of drop you get. Just for 1 week, let's experiment with counting your carbohydrates and see what's the rise in your blood sugar when you only eat 30 and what's the rise in your blood sugar when you eat 75. What's the rise in your blood sugar when you drink a Diet Coke or the rise in your blood sugar when you drink a real Coke? And they'll come back and they'll go, "Oh, I didn't realize it affected me that much," you know. And then we've got some proof that they collected on their own.
Mm.
And then I say, "Okay, now given that information, it is your body.
Right.
I'm not going home with you. I don't live in your body, right? You get to decide if this is worth the effort to you or not." And most people will say, now that I see that, it is worth the effort to me and I want to do it. And then there's, 1 out of 20 who will say, you know what, lady, I don't care. And I'll say, all right, come back to me when you care. Right?
Yes. I That is awesome because like I said before, idea of you giving them ownership to their actual health.
Hmm.
I would hope for some people that it's like it's almost like when a kid is in a situation where you're not giving them actual, okay, you do this, this, and this because I said so. It's like, oh no, this is where you are because of your circumstances now. And when you're ready, you can come back to me. I love that.
I can't make you want to care about your health. I want you
Right.
to. And I naturally care about people's health for whatever reason, but you are where you are, right?
Right. Exactly.
Yeah. Hmm.
So your actual, I was looking at your website and you have this 5-day diabetes friendly meal plan that's like free. So anyone who wants
Hmm.
to like check out Julie's website, it's actually really, it's beautifully put together. I love the way it looks. But
Oh,
this,
I'm getting ready to have it redesigned.
great, I love it. I mean, and then I'm pretty sure the redesign is gonna look just as amazing. Seriously, I like it. It looks great. This 5-day diabetes friendly meal plan, is this something that actually anyone could like take on? Because and the reason why I'm asking that is because when you have diabetes, not everyone in your household has diabetes, right?
Right. Mhm.
So is this something that everybody can like
Yes.
everybody in the house can eat this and not feel like, oh, this is only for mom because of her diabetes?
I don't want my patients to have to make 3 different meals, right?
Right.
You don't want it's not fun. It's hard enough to get one dinner on the table. If you got a job and you got kids and they're playing sports and blah 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 blah, who wants to have to cook a separate dinner, right?
Right.
So there's really nothing tremendously it's not a diabetes diet is not highly specialized, right?
Mm.
It's low-ish in carbohydrate, it's high in fiber. There's a ton of vegetables to keep you full without sending your blood sugar to the roof. And that's all that there is to it, really. So you can read all this stuff on the internet about, people come to me and they're like, oh, I read this and I read this and I read this and I read this and now I'm confused and now I don't know what to eat. And I'm like, look,
Right.
you can have real food. Okay. You can have real food. It's just how much of that starchy and sweet food can you have? We're going to limit that. You can get full on this other food over here, which is regular everyday stuff that you always normally eat. You're going to be fine. You're going to make one meal for the whole household and it's all going to be under control, right? So yes, anybody could eat that meal plan.
I love that because I mean, I remember as a kid, and this is when my father he had kidney failure, and when we found out, and this was in the 80s, and he was actually I think I was telling you about this, maybe I don't remember, but he actually did peritoneal dialysis,
Mm-hmm. Yeah.
right? And for those that don't know, peritoneal dialysis, it's very extensive in terms of like how you have to manage it, and it's pretty wild. And he was actually managing this on his own, right?
Wow.
At home. He would come home from work on his lunch break and do his dialysis. I still am like in awe in the fact that he actually did that back then. But anyway,
Mm-hmm.
we had to change our diet. Initially, my mom was making separate meals for my dad. Like it was just his stuff. She was cooking everything with Mrs. Dash. It was a whole situation.
Mm-hmm.
And then we all had to take on that. And I just remember some days just being like, oh, this food is so gross. It's nice to know that the plans you've put together is not something that's going to be like, oh my gosh, we have to eat this now. Like, it's something that everyone can enjoy and still have good nutrition. So that's great.
Yeah.
You know?
And that's just a taste of a meal plan. And, there's plenty of meal plan services that if people need those, they can just reach out and, they're super cheap where you can get like fresh diabetes meal plans for $9 a month, every month. If you get sick of this stuff you're used to eating, And
I think
I
that
have a
was
friend, he's a renal dietitian and she runs Renal Diet HQ, I think it is, Renal Diet Headquarters.
okay.
And he does kidney meal plans for people.
Oh, wow.
Yeah.
That's interesting. Yeah, because I remember even with that, I mean, my father obviously had diabetes, and then that's what led to him
Right.
having renal issues, kidney
Mhm.
issues. And so a lot of our meals had to be focused on one, managing his diabetes, and then two, dealing with like, his issue, any type of foods that have like high potassium. Like we had to monitor so many things.
So many things with the kidney.
Yeah, it was intense. But your
Yes.
book, I wanted to talk about your book. So it's 30 Days to Tame Type 2 Diabetes. What what prompted you to write this book? Like what was the motivation behind this?
Well, people come in and they're confused and I can't talk to everybody, right?
Right.
So I wanted a resource for people. I wanted a non-sciencey book for the average person who just comes in and feels overwhelmed and they want a step by step, just give me a little bit of bite-sized information that I can do, read 5 to 10 minutes a day. And by the time the 30 days is up, I feel like I know what I'm supposed to do. So it's kind of like if somebody were to come to me for 3 or 4 sessions, what would I teach them throughout those 3 or 4 sessions, over a course of a month? They get that in a book form. So it starts with the first day is like, hey, you're going to be okay. This is going to be fine. It's just a reassurance, right? And then, okay, here's our baby step for today. And so as I'm walking them through the book, I'm starting with, if you have not been an exerciser, today I want you to find a pair of tennis shoes, right? Sneakers. And then the next day, okay, pick a point. If you've got a mailbox or a stop sign that's 2.5 minutes from your house, go there and turn around and come back. And now you've walked 5 minutes. And by the time the 30 days is up, you're walking 30 minutes. 30 days at the end, you're walking 30 minutes. So I'm getting them on a walking plan, and I'm also teaching them principles of what they need to eat and, all the other stuff you have to know about how to manage low and high blood sugar and all of that. So that I just wanted it to be simple.
I love that. And so, like I said, I didn't actually give the proper title. So it's 30 days to tame type 2 diabetes, a step-by-step daily guide to managing blood sugars with diet and exercise. It's on Amazon. And where else can people find this book?
That's the only place.
Only place? Okay.
It's on Amazon.
Amazon is the place. I mean, sometimes I battle back and forth with if I should listen. I love Amazon. I'm on there probably every other day. God bless. God bless.
I know.
Yeah. So, Julie, something else I wanted to ask you right before, this is amazing, like just the information you shared. So, with the book, are there like opportunity, are there like ways like you can kind of like write? Is it like a guide where you're like writing in the book, or how does that work?
It doesn't really have space to write in it. The electronic version has live links in it, so you can download resources from the website. You just click, if you have the Kindle version or whatever, you just click and you're like, oh, okay, go here and get the meal plan. Go here and print out a chart about what to do if you have low blood sugar. Go here and print out a chart about what to do if you have high blood sugar. And so that's very easy for people who like to read an electronic reader. And the paper version has those links too. It's just they're spelled out for you and you would have to type them in to find those resources.
Yeah, so that's really cool that the hyperlinks that's excellent. I love that because I am that person. I love clicking on links and just kind of going down a rabbit hole of trying to find information. That's amazing. You
Yeah.
brought up something. So before we go, I hate to keep holding you because I know your time is precious.
No, you're fine.
The idea of high blood sugar and low blood sugar, I think this is something great to kind of like end on because I think some people really have a hard time understanding that and then also like just kind of like maintaining. So if we can kind of like get the down and dirty of what does that look like and how do you like what's the most important one in terms of like is the high blood sugar the one you got to really be concerned about, or is it low blood sugar, or is it both? Like what does that look like for the person that's actually managing diabetes or type 2 diabetes rather?
Well, you have to be concerned about both, right? But the one that's going to put you in the floor right this minute is low blood sugar.
Okay? Right.
If you take too much insulin and or you don't eat when you take your fast acting insulin, you potentially can pass out. And if no one's around you, you might not wake up. So a blood sugar under 70 is considered low, and a blood sugar under 55 is considered severely low and might require a trip to the hospital. And that's going to look like, potentially like shaky, confused, sweaty, hungry, tired, and it can get to the point where you're slurring your words. You might look drunk, and then you might pass out. Is what it's going to look like. Right. But then on the other end, high blood sugar, the ADA guideline is anything, we want to keep our blood sugars under 180 if we have diabetes. But where we start feeling like it's really high is above 250. But sometimes people don't feel that at all, right? Sometimes they just feel sleepy or tired and they're like, oh, I need to go lay down and take a nap. Sometimes it's headachy, but then when it gets really bad, sometimes it's nausea and vomiting. But, it's a little bit hard to know sometimes which one is which, especially if you've had diabetes for a long time and you've kind of lost some of that sensation. So you just got to check, and if your loved one is acting weird and they have diabetes, don't decide, oh, they must be low. Let me hand them some hard candies. Because maybe they're high and you're exacerbating that problem, right? Check their blood sugar.
Thank you so much. I am so glad we ended on that because I think that's kind of like the driving home force is just make sure you're checking your blood sugar because sometimes those symptoms can present and you're thinking, oh, it's probably because they're low. Like you just said, no, it could be that their blood sugar is getting too high, and I'm throwing you a peppermint, and then we're into like DKA. Hopefully, we won't get that crazy, but you know what I'm saying? Like, oh my gosh, no, this was awesome, awesome, awesome. Anything else that you want to share with us before you go? I might have missed because I'm like, diabetes is such an amazing and fascinating topic. I just don't want to miss anything.
Well, if you don't feel well, if you're tired, if you're draggy, if you're just like, I'm thirsty all the time, or I'm urinating all the time, those are early symptoms of diabetes. 10% of the US population has overt diabetes, and another 30-ish% has prediabetes. So if you're over 40, you should be getting your blood sugar screened every single year, because we want to catch it early and turn it around if we possibly can.
Thank you so much, Julie. No, this has been amazing. And I hope you all enjoyed this conversation. I'm excited to talk more about how eating and nutrition and diet and exercise affects us with our everyday health. And I think, and you let me know if you agree or not, I think a lot of people now see more than ever that how important what they're ingesting in terms of food is actually the benefit or the demise of their health. I feel like more people are really coming around to that as of what was happening when I was growing up,
For sure. We only have the air we breathe, the fluid we drink, and the food we take in to directly affect our health, unless we start taking drugs.
No metformin, no insulin if I don't have to. But if I do have it, I'm still going to try and do the best that I can in the process, right?
Mm-hmm. Yeah.
Oh my gosh. Julie, thank you so, so much.
Thank you for having me. Yeah. It's been fun.
And so I was like, go ahead. Sorry.
No, it's been fun to be here. Thank you.
You are so welcome. You all, when you get a chance, definitely check out Julie's book. Like I said, it's on Amazon. It is 30 Days to Tame Type 2 Diabetes, a step-by-step daily guide to managing blood sugars with diet and exercise. Julie also has one-on-one coaching, and you also have group coaching, right, as well?
I haven't done the group coaching in a while, so I usually stick to one-on-one.
Okay. So you can definitely check that out on Julie's website, and her website is Julie Cunningham. And I'll have all this information in the show notes as well. So you guys can definitely check out Julie. If you want to work with her, it'd be amazing. You just have such a warm energy. I can't imagine people not wanting to work with you. So
thank you.
Oh, you are so welcome. Thank you all for listening to this week's episode of the Eat and Me podcast. We got to get on this diabetes management, not for only ourselves, but our friends and family. I think another thing too, before we go, I keep saying we're going to leave. We're not going to leave. We're going to leave. I think another thing too is for those of us that have family and friends that have diabetes and maybe we're frustrated with them, meet them where they are. I think that's another really important takeaway too. Just meet them where they are and just support them as much as we can. It's not easy for them, right?
It's not easy. And never say to them, do you really need to eat that?
Yes.
Yeah, no, if they need to eat that or not. That is 100% not helpful. Right?
Yeah, for sure.
Change what you feel and what you buy and what you bring into your home, but don't ever say, do you need to eat that?
Yeah, exactly. Yeah. Julie, this was awesome. All right, y'all. Like I said, we are looking out for y'all in every way we can. Check out Julie's book. Check out her website. If you need that one-on-one coaching and support, she is there for y'all. This has been great. And we will see you all next time, or actually next week on the podcast. Have a good one, y'all. Thank you, Julie.
Bye-bye.